And welcome to the Dr. Bob Show. Are you having trouble getting to sleep at nighttime? There's nothing as refreshing as a good night's sleep. Do you have trouble getting to sleep? Do you wake up in the middle of the night and can't go back to sleep? Do you feel tired during the day? Are you not rested well? Is it because of your sleep pattern? What's going on in your sleep life? We'll be spending most of this show talking about how to get a good night's sleep. My guest is Dr. Chris Nolte. Dr. Nolte is a board-certified sleep specialist. He'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a lump in your neck or under the arm. Could it be dangerous? Could it be a sign of a cancer in a lymph node? We'll be answering that question. And what can you do about a blocked sinus? There's nothing more miserable, but there's lots of things that you can do. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Chris Nolte, board-certified sleep specialist, and we're going to be talking about how to get a good night's sleep. Chris, welcome to the Dr. Bob Show.
Thank you for having me.
First of all, how much sleep do people need?
We think that the average American adult needs about 7.5 hours, and the average American adult gets about 6.5 hours.
So we're getting sleep deprived. Now let's say I get 7.5 hours sleep for a couple of weeks and I'm really doing good, and all of a sudden I go to bed later and I have to wake up early and I get 5 hours sleep. What happens if short term I don't get enough sleep?
The front part of your brain, which is where your focus, your attention is, your personality gets affected by that acute sleep deprivation. So you might have experienced that. You're maybe a little bit brain foggy the next day, troubles recalling information, maybe a little bit moody, irritable.
Yeah, and I find out I have to be very careful. If I didn't get a good night's sleep, I find myself more irritable. I always got that brain fog. So it affects the thinking part, the frontal lobe.
Exactly.
What happens if somebody just doesn't get enough sleep? They get 5 hours sleep for 3 weeks or for 3 months. What happens to that person?
That little bit of sleep deprivation builds to produce pretty substantial deficits in the way that the person functions throughout the day. This is becoming a big issue in occupational medicine. People at work in safety sensitive positions. Not only focus is off, attention's off, reaction time's off, problem solving ability gets affected by this. So this really poses a safety concern. From a more medical or health standpoint, we know that when people are sleep deprived for long periods of time, rates of diabetes go up, they become more resistant to insulin. Heart problems go up. Obesity, this is a big focus here in the last several years. We're starting to learn the links between sleep deprivation and obesity, which is a pretty tight link.
So does it work the other way around? If you get enough sleep, does obesity go down? Can I sleep my fatness away?
Well, that's a key component. I don't know that's the full answer, but yeah, we're really pushing our patients a lot harder now to really aim for that 7 to 8 hour benchmark for sleep. And when we're seeing evidence that they're trying to do the right things, they're exercising, they're dieting, and they're frustrated by the lack of progress, you start to ask about sleep duration. You're not surprised when they come back saying that they get between 6 and 7 hours, just that little bit of sleep deprivation that's fighting their efforts.
So if somebody's going to bed at 12 and they're getting up at 6 or getting up at 5:30, they're getting 5.5 to 6 hours sleep. Can they catch up with a nap? Do naps help people? Are naps good for people, or do they keep people from going to sleep?
Yeah, so we do, napping is sort of a double-edged sword. Yes, we think you can repay that sleep debt. The only reasons we don't like napping is if it starts to lead to troubles falling asleep that night. They've looked at the performance improvement that you can get from a nap and how long should the nap be. And it looks like you get all of the good things about a nap, terms of your reaction time, problem solving, if the nap's 10 to 20 minutes. The longer you nap, the deeper into your sleep you get, the harder it is to recover from that. We call that sleep inertia.
Is there any information? I've heard some people say, drink a cup of coffee, get the caffeine that stimulates the brain, take a nap for 20 minutes, and you'll really be ready to go. Is there any truth to that?
Yeah, they did. Well, they did a similar experiment in military sharpshooters. They kept them up for 3 days and tried to see what could they do to reverse the effects of that acute sleep deprivation as quickly as possible. And in studies of caffeine, they usually use tablet form, not a coffee where you're sipping it over 10 to 20 minutes, something like that. And sure enough, it takes about 30 minutes for tablet caffeine, 200 milligrams, to get into your system. So the soldiers would pop the pill, roll over, take a 30-minute nap, and as soon as they were done napping, the caffeine was in their system, and it reversed 3 days of sleep deprivation on objective shooting performance. Pretty amazing.
That's very, very interesting. If somebody is not getting a good night's sleep, what are the problems more frequently? Can't get to sleep, or wake up in the middle of the night, can't get back, and what do you do for both of them?
Yeah, so we think, well, you'll hear patients often complain of both, but I would bet you across all patients it's troubles falling asleep initially, and it's stressful living. There's all kinds of stressors, and I think that's the biggest component for most healthy adults is just being able to shut their mind off. When you start to hear problems of people staying asleep, they're waking up for no good reason, my antenna are up for sleep disorders, and that's where, if we're going to do an evaluation of their sleep, that's the kind of insomnia that I will do a sleep study for. So
how do you teach somebody to go to sleep at night? I go to bed and I just can't go to sleep. That's not my problem. I close my left eye up to my right eye and I'm asleep. But how do you teach people to fall asleep?
It's really regularity and routine. All of those books that we got when our kids were little, emphasis to try to get those little babies asleep. I hate to say it, but the principles are pretty much the same for adults. We're not a whole lot different than our pets in that circumstance. If you can be consistent and reward yourself in good behaviors, you'll start to produce a change. And one of those key things is being consistent with your bedtime and your wake time, developing a very regimented bedtime routine. We do this for our kids all the time.
What kind of routine for adults?
So often we want it to be one directional. So you move from common area uses of the house, say family room, den, that kind of thing, to the bathroom, to the bedroom, not all this back and forth business that sometimes takes hours to do to get your kids asleep. We're the same way. So if you're going to eat something, watch a little TV, that then gives way to a hot bath, which then gives way to relaxation into the bed.
And so when you get into the bedroom, should there be a nightlight, or how big should the pillow be, or how soft, how much covers, how cool? What's the temperature what we should strive for?
Yeah, this is very individual. They've studied components of what you just asked. And believe it or not, the recommended room temperature to sleep is between 60 and 65 degrees. It's pretty cold.
Be having icicles coming off the nose.
Exactly right. So a little bit colder than a lot of people. So we'll often advocate for people to lower their bedroom temperatures a bit there. Light, sound, noisy bed partners, pets, kids. People are variably susceptible to those influences, but we have some people who do what I call cowboy sleep. They're always with one eye, one ear open. Those people, we really try to emphasize sleep masks, white noise machines, very dark, very quiet. Some people need that monotonous sound, not TV where it's up and down in terms of brightness and volume, but something consistent and low level.
Why do we say count sheep? I've never counted sheep at nighttime, but is there a reason why some monotonous type activity in your brain would help you go to sleep?
Yes, this is actually a big emphasis now. For a long time we've known about cognitive behavior therapy. This is a kind of therapy done by specially trained providers that try to work on the cognitive aspects. That's the counting of the sheep exercise you just talked about. And some of the behaviors. What do we do in the hours before bedtime that could be fighting our efforts to fall asleep? Drinking caffeine late, smoking up to bedtime, having a nightcap, that kind of thing. Counting sheep is sort of a variant of what we now call mindfulness therapy. And this is trying to keep the patient focused in on their breathing or counting sheep, something monotonous, to sort of calm down the mind and prepare it for sleep.
If somebody goes to sleep, wakes up in the middle of the night, and can't get back to sleep, are there some things we can do?
Several.
And that's what we're going to be talking about. Several things you can do if you wake up in the middle of the night and you just can't go back to sleep. Several things. You'll want to stay tuned. We're talking with Dr. Chris Nolte, board-certified sleep specialist, and we're talking about how to get a good night's sleep. We need 7.5 hours sleep, most adults do. If you're not getting that much sleep, it can bother the body, and so it can cause heart problems, even obesity if you don't get enough sleep. Naps for a short period of time in some people, as long as they're not interfering with sleep later on, can be a good thing. Shouldn't nap longer than 20 minutes. Chris, let's talk about when you go to sleep, you wake up in the middle of the night, you come back to bed, and you can't get back to sleep. What do you tell that person to do?
You get 20 minutes to lie in bed. If you can't fall asleep within that 20 minutes, you have to get out of bed. We're trying to really cement in the mind the link between that bed and sleep. The longer you lie there staring at the ceiling, getting frustrated, the less tight that link is. We call this stimulus control. We want that bed just to equal sleep for you, not frustration, not playing on your phone, not starting to worry about the next day's activities. We have a lot of patients who get up and in some ways inadvertently reward that behavior by eating, doing chores around the house, and it's almost like giving your pet that little treat when they sit down. That actually, we think, propagates, that keeps it going night after night. So you have to be very cautious. We say go into another room, do something that's not rewarding, relatively boring, maybe flip through a magazine, that's something that's not going to capture your attention, and then once sleepy, go back to bed.
Once sleepy, go back to, what if you don't get sleepy when you're flipping through a book? You just try and rest, relax, and then go back to bed and see if you can go to sleep.
Yeah, and one of my key things when I'm hearing that story is I'm worried about the body rhythm a little bit there. For patients who tend to wake in that early morning hour, it's sometimes a body clock problem. And the best treatment for them often is getting exercise and light exposure late into the evening. It helps realign their body rhythm with what their sleep schedule is.
So if you give somebody light, if you put them in a bright room, then that'll change their circadian rhythm and they'll maybe be able to sleep longer. I want to talk about sleeping pills. I just can't get to sleep. I'm having trouble getting to sleep, and I just always feel tired, and nothing I've done works. Can you give me a sleeping pill? Mm-hmm. Is that good advice, or can sleeping pills be dangerous?
There's been a shift, I think, over time with our opinion about sleeping pills. Sleeping pills used in a very limited fashion can be helpful to break a bad cycle. But we think that long-term use of these pills, which really were designed for a week or two use, can start to lead to health problems. So the major emphasis over the last several years has been to really put those aside and work on more healthy behavioral modifications, cognitive therapy, that counting the sheep example that you gave. These were tested head-to-head against some of the major sleeping pills, and they proved to be more beneficial to the patient.
So what we try and do is get somebody to not use their sleeping pill. When do you decide if you need a sleep study to see if something's keeping that patient awake?
I usually have two triggers in mind. One, for troubles falling asleep, if that patient has tried just about everything and failed, sometimes it's better to take a step back and reassess that patient with a sleep study to see, are we missing anything?
What could you be missing?
Probably the most common, believe it or not, is generalized restlessness in the body. That often indicates that the iron levels are low. When patients report, well, they fall asleep just fine, but it's trouble staying asleep, they're waking up for no good reason, that often sends up, again, red flags that we might be dealing with a sleep disorder there. Again, restlessness is common. Sometimes breathing problems, snoring, sleep apnea, which we've talked about before, can be present there as well.
So tell me about restlessness, restless leg syndrome. Do people really get restless legs? Is it all day? Is it just at bedtime? When does it occur?
So yes, the name is a little bit misleading because even restless leg can occur in the arms. A lot of patients don't give you a history of restlessness. They give a history of pain. This is very common in kids. A kid version of restless leg is growing pains, knees down, only shows up at nighttime, which is where restless leg first begins. When you're trying to relax, sitting, lying in bed, movement, rubbing, stretching seems to alleviate those symptoms. As soon as you stop, it can come back. Low iron is the most common cause for that.
You were telling me about an executive, a CEO of a company who you said, I think it's maybe restless leg syndrome. And he said, oh, come on, it's not that. What happened? Tell me about that story.
Yeah, so he had no clue. He knew he couldn't fall asleep. I thought maybe it was stress with the job worries that he had, and certainly that can contribute. But had a sleep study done, was moving his legs a lot without him even knowing that. Was started on a medicine for restless leg, and a few days later was falling asleep without problem.
You said he called up and said, Doc, I owe you an apology. I've been sleeping
Exactly right.
really well. So there's restless leg. Are there any other sleep problems that you see frequently that you can tell right off the bat?
There are several that occur once the patient's asleep. Sleep apnea is probably the most common thing that we see. There's a lot of research to show that that's bad for you in many, many ways. And I know you've had shows on that before, but sleep apnea is a breathing problem at night linked to heart problems, diabetes, just overall bad health. So that's very, very common. We're starting to see a lot more pain-related sleep problems. And believe it or not, it's that same cognitive behavior therapy that seems to help alleviate a lot of those. Mattress switching out. So there's a lot of debate about your bedroom environment, how to optimize that. And we think while it's an individual's preference that a medium to firm mattress is probably the best. And changing out the pillows regularly is also helpful.
Now tell me about a sleep study. There gets to be a time where in order to really find out what's going on, you have to get a sleep study. It seems to me like it would be very difficult for a patient to go in an unusual environment, to have where do you put what's sleep study like?
So sleep studies sort of come in two flavors these days. If it's a straightforward sleep apnea concern in a healthy person, there's a very small monitor that the patient can wear at home. If it's not that, if it's a sleep quality problem, insomnia problem, just not really sure what's going on, the classic sleep study puts sensors across the body. So we're looking at brain waves to see what stage of sleep the patient's in, how often do they wake. We try to find out what wakes the patient if we can. So there are sensors on the legs, across the body, looking at the breathing as well.
And when somebody has a sleep study, do they have trouble going to sleep? Do they sleep easier than they think? When you come away with a sleep study, does that help you design a boutique program for that person to get sleep?
Yeah, it's an unusual environment for sure, but patients often do just fine in a sleep test environment. Sometimes they report better sleep there. We use that information to our advantage. Some patients will answer a questionnaire the next morning, and we ask them how long did it take them to fall asleep, and they might say it took them hours, but by brainwaves it took them 8-10 minutes. That clues us in that the patient is suffering from a different style of insomnia. So these are the things that I'm looking for when I'm trying to create a treatment plan for that patient.
It must be fascinating to look at a person's sleep pattern to try and help their life so they can be more productive, can be alert, can feel better, can perform better, can be a better person just by guiding sleep. Chris Nolte, you're a wonderful teacher. Thank you for coming to the Dr. Bob Show. I hope you'll come back again.
Yeah, thanks for having me.
I think sleep is fascinating. Well, we've talked about obstructive sleep apnea before. We'll have to do another show on that and talk more about restless leg syndrome, talk about narcolepsy, some of the real sleep problems, sleep diseases. But first of all, we're going to come back and we're going to be talking about that little lump in the neck. Could it be a lymph node that's swollen from cancer? What does that feel like? And Sinus blockage. What can you do for it? A whole lot. You want to stay tuned. Yes, there's nothing like a good night's sleep. I want to thank Dr. Chris Nolte. Wonderful discussion on getting a good night's sleep. Now, questions from you, the viewer, that I think will be important to your health. Dr. Bob, what does a lymph node in the neck mean? That's an excellent question. What are lymph nodes, first of all? Lymph nodes are usually little kidney bean shaped little lumps. They're part of the immune system. There are lymph vessels that bring fluid to the lymph nodes. If there's infection, it will bring the infected material up to the lymph node where it will be trapped, where the lymph node begins to build up immunity toward that infection. When it does that, sometimes the lymph node gets a little bigger, gets a little tender. So what's a normal lymph node look like, and where are they normally? The neck is very, very common. If people get a sore throat, if they get an infection in the ear, on the scalp, then lymph nodes in the side of the neck can get swollen. If they are rubbery and small, then they're going to be benign 99% of the time. If they get slowly bigger and continue to enlarge, and they are hard feeling and they don't move it as much, those are danger signs. And that's a sign that you want to see your doctor. Your doctor will be able to get a biopsy and he'll be able to see what is causing that lymph node to swell. The neck is one area. The groin is a common area. If you have infection in the feet, it can go up and be trapped in the groin. If there's something going on that's bad in the leg, lymph nodes in the groin can swell. In the axilla, under the arm, is another common place for people to have lymph nodes. That could be coming from infection in the upper extremity. Above the collarbone is a common area for lymph nodes to be. All of those areas are usually sites where infection has come, has been isolated, where the immune system works to protect you. If those lymph nodes are hard, not movable, and keep enlarging, that's a sign it must be checked by a doctor to make sure that it's not a malignancy. So those lymph nodes are an important part of your health. Pay attention to them. Question number 2. Dr. Bob, how do I get rid of a blocked sinus? Let's talk about the sinuses. The sinuses are holes in the head that drain into the nose. Now, there's frontal sinuses in the forehead, ethmoid sinuses, maxillary sinus, and in the middle of the head, sphenoid sinus. They all will drain into the nose into an area called an osteomeatal unit. It's a little tunnel. If that tunnel gets blocked from, it can be abnormal anatomy. It could be from polyps in the nose. It could be from infection in the nose, a common cold that blocks that sinus. Or it could just be abnormal anatomy that blocks the sinus. And it causes pain and frequently infection in those areas. So what can we do? Well, number 1, we can think about what are the causes. If you continue to get recurrent blocked sinuses, need to see your doctor on that. But it could be just a crooked nose. It could be that you just simply need a saltwater spray. There's nothing like that. I always say it soothes the soul of the savage beast, which is your nose. So saltwater spray, 5 sprays each nostril 3 times a day, sometimes will quiet down the nose where the sinuses will drain. There are some decongestant nasal sprays. Afrin would be one. Danger, you only want to use it for 3 days. It will open up the nose and let the sinuses drain, but there is a rebound effect that will start occurring after day 3, where the nose will swell and actually get worse. So the underlying cause, if the doctor finds out it's an allergy, there are allergy medicines. Skin testing can identify what you are allergic to. If there's infection where you're blowing out yellow or green that just won't go away, your doctor can put you on 2 to 3 weeks of an antibiotic and appropriate medications to get rid of that. So if you're having blocked sinuses frequently, then you need to be sure that you work that out with your doctor. He'll be able to decide and help you decide what needs to be done to get that blocked sinus to go away so that you'll feel better. That's all the time that we have for this show. Remember those things that we always want to work on in the Dr. Bob Show. Number one is exercise. The most important thing you can do. Exercise will make you sleep better. Exercise will lower your blood pressure. Exercise will help you lose weight. Exercise will help you lose stress. There's nothing like exercise for the body. Make it regular exercise. Get a friend that you can go out and exercise with. Listen to your body. Be sure you don't exercise beyond your body's ability. 7.5 hours of sleep. If you're not sleeping well, remember there are some things you can do. Make the bedroom a sleeping room. Make it dark. Have a good pillow. Make the room cool. No extraneous noises in the bedroom. And watch yourself fall asleep good. Eat properly. Start that day off with fruits. Later on, vegetables and fiber. Those are the things that the body wants for the digestive tract to work better and for you not to have stomach problems. We are what we eat, so eat well and you'll look and perform well. And most of all, it's that laughter in your life. Laugh a lot and you will stay healthy.